Good morning and welcome to our YouTube channel. I'm Santrell.
I'm Samantha.
I'm Amber.
And today we have two nursing students from HBU with us. We have Celeste to my right and we have Sarah to my left. And today's topic is asthma. Hey guys, so today we're going to be discussing asthma. So let's begin with the definition. It's a chronic inflammatory disease of the airways which leads to recurrent episodes of wheezing, chest tightness, and cough. The main components of asthma include airway inflammation and airway constriction. Both of these components may affect the airways of your lungs, making it more difficult to breathe. Okay, so let's read a first question from the viewer. Amber?
Okay, the first question is asking about the clinical manifestations of asthma. The first one would be that it is unpredictable and variable. There's recurrent episodes of wheezing, breathlessness, coughs, tight chest. It could be abrupt or gradual, and it could last minutes to hours. Expiration may be prolonged, bronchospasm, edema, mucus in the bronchioles, and narrows the airways. And air takes longer to move in and out. Wheezing is unreliable to gauge severity. Severe attacks may have no audible wheezing, so wheezing isn't the only way to diagnose it. The term wheezing may also be used to describe sounds arising from the nose and upper airways. Cough variant asthma is when the bronchospasm isn't severe enough to cause airflow obstruction. Difficulty with air movement can create a feeling of suffocation. Patients oftentimes get anxious and they express they're not able to take a deep breath or feel like they can't breathe at all. And an acute attack usually reveals signs of hypoxemia, which include restlessness, increased anxiety, increased pulse, blood pressure and respirations, and wheezing. And main clinical manifestations, they say it's a silent chest. The next question.
Okay, so we're gonna move on to a different viewer. They want to know what the diagnostic studies are for asthma. Okay, so we would first need a detailed history and a physical exam. Also, their peak flow monitoring, a pulmonary function test would be needed, a chest rate, and also their ABGs, which are arterial blood gases, oximetry, allergy testing, blood levels and of eosinophils, a sputum culture and sensitivity, and also a niox-mino, which is basically a handheld point of care device which measures fractional exhaled nitric oxide. And also, a lot of people confuse asthma with being contagious or a communicable disease. It's actually not. What this means is that it is not transmitted from a patient to a healthy person, either by direct or indirect contact. Okay, so we're going to go back to Santra now.
Okay, so let's just read another question from another viewer who's actually asking about risk factors. Amber, can you cover that?
Yes. The risk factors is that it can be a genetic thing, like a blood relative with asthma. If the individual has another different kind of allergic condition, such as allergic rhinitis, being obese, being a smoker, or being exposed to secondhand smoke. Then environmental issues like chemicals, such as pollutants and irritants like pollen or mold, can also really put you at risk for having an attack. And then the next... That's really all the risk factors. Let's take another question.
Okay, so this actually isn't a question from a viewer, but let's just piggyback off of what Amber said about environment. So for prevalence, asthma seems to be more prevalent in areas with high pollution and high pollen counts. Also in cities in general, because they are more likely to have pests, all of which commonly trigger asthma. It is often more problematic in poor urban neighborhoods as well. I actually do see here a question from another viewer, though, asking about complications. Samantha?
Okay, so we're going to get into the complications of asthma now, which are actually classified into mild, moderate, severe, and life-threatening. So for the severe and life-threatening exacerbations, these include the patient's respiratory rate would be more than 30 breaths per minute, and their pulse would also be greater than 120 per minute. These patients are usually seen in the emergency room or they'll be hospitalized. And for life-threatening asthma exacerbations, these may occur in patients. These patients will be too dyspneic to speak, which means they're unable to breathe, perspiring profusely, and they're drowsy and confused. and they will also require hospitalization, and sometimes they're often admitted to the ICU.
Okay, and we do have a question from a HBU student, Celeste 342. She was actually asking about how this could be relevant to the HBU community, the students, faculty, and things like that. Amber?
Okay. Anyone can have asthma, so any student or faculty member at HBU can be affected, especially during times that there's like a high pollen count, and especially this semester, I would say, with there being such a high mold occurrence after all the flooding and stuff that we've dealt with here in Houston. So people can be more affected by what's around them, but regardless, anyone can really be affected by asthma.
Okay, and speaking of just the HBU and community in general, I just want to let everyone know that asthma is very common and it does affect about 17.5 million Americans. However, women are more likely to be affected by this by up to 76%. So women, just be on the lookout for that.
Okay, so we this is our part for now. We're gonna go into a commercial break. We'll be right back.
Okay, welcome back, everybody. Now we have here with us two special guests from HBU. They're nursing students. We have here on the left of me Celeste Ross, and to the right we have Sarah Hanshi. They're here to help us answer more questions regarding asthma. Okay, so our first question is from user 325. They're asking about the effects of daily life. Celeste, can you help answer that, please?
Yes, I can. So how serious the case is depends on the severity of the patient's asthma. They are typically more limited in the amount of activities that they can do and perform. They have to have a lot of support from family and friends, and also exactly the patient education about how much they know on asthma, knowing how to avoid things that trigger their symptoms.
Okay, let's look for the next question. Okay, from user 322, I love you. They're asking about prevention of asthma.
Okay, so great question. So what are some things we can do to prevent? So first off, let's look at some allergens that can cause your asthma attacks. So we've got things like cockroaches, for example. So you don't want to leave food around. So something like this, you want to throw it away. This cannot be left around. So furry animals, so if you have any pets, you don't want to allow your pets to be into your bedroom. You want to, if you can, keep them outside. Dust mites and molds, so replace your shower curtain and fix your leaky pipes. Okay, so exercise-induced asthma is another type of asthma that can be exacerbated during the physical exertion. So especially if you're trying to exercise outside in the cold air, you want to try to wear a scarf, and that way you can cover your face, and or maybe even a mask would also reduce your symptoms. Some other triggers could be cigarette smoke and wood smoke, vehicle exhaust. Also, psychological factors can worsen the condition. So if you have extreme emotional stress or any anxiety, you want to try to avoid situations that can cause that. Okay. And do we have any other questions?
Okay, yeah, let me look. Okay, so this username is very inappropriate, so I won't be saying it. However, the question is asking, which I think is a good question, how people with asthma may feel. Celeste?
Okay, so each person's asthma experience is unique to them, but there are some feelings that many people with asthma experience at one time or another. So that'll be like fear and anxiety of the diagnosis. They might be hypervigilant and want to stay ahead of their treatment. They may feel that they have a loss of control because now they have so many medications to take, or they have to watch out for this trigger. They might be in denial. They might be angry. They might feel guilty, embarrassed, especially in a younger population, and they might be confused as to why they have it.
Okay.
Any other questions?
Yeah, we have another question from Amber 45, asking about the treatment and goals.
Okay,
Sarah?
so I can answer that. So treatment and goals. So acute asthma exacerbations. So with that may need O2 therapy, and you want to monitor the pulse oximetry and ABGs in severe cases. So medications can provide quick relief asthma. For asthma, such as bronchodilators, they work by relaxing the muscles around the airways of the lungs. So example is short-acting beta agonists, They are also referred to as quick relief medicines, and they act within minutes to relieve symptoms of asthma. This type of medicine is typically delivered by a device called an inhaler. So when you inhale the dose, the medicine quickly relaxes the muscles around your airways. If it does not relieve your symptoms quickly, you need to notify your healthcare provider immediately. Long-term asthma control medicines are taken daily, whether you have symptoms or not. Most are anti-inflammatories and work by reducing the inflammation of the airways of the lungs. These medications can help to prevent symptoms, so they are different from quick relief medicines, which are used to relieve sudden asthma symptoms when they occur. So some examples of long-term asthma medications include inhaled corticosteroids, glucogen receptor antagonists, IgE inhibitors, and theophylline. And then some goals of the treatment. Of course, you want to try to reduce your asthma symptoms, if any. Sometimes you may have them occur during the night, so you want to try to reduce asthma symptoms that can awaken you during the night. And you want to try to have little or no time off from school or work from your symptoms. You want to limit your participation, or you want to have no limits on your participation in physical activities, and no asthma-related emergency department visits or asthma-related hospital stays.
Ooh, that was a mouthful. Okay. So what we're going to do, we're going to just answer one last question because we seem to be running out of time here. Our last question is from I'm Team Jacob from Twilight. They want to know, what are the support groups that they may have for people with asthma? Celeste?
Okay, so a great support group that I found is called Asthma and Allergy Foundations of America. Pretty much, they allow you to find groups based on your geographical area. So when you go onto the website, AAFA.org, again, AAFA.org, you're able to put in exactly your state and city, and then they'll link you with a helpful person to tell you how to manage your symptoms, and great just support groups to allow you to talk to someone if you just need someone to talk to. You're also able to navigate through the site. They have very helpful tabs at the top of the screen to answer any question that you may have. Also, there are great rehab facilities here in the state of Texas. Asthma Lung Center of Texas is one. They focus on teaching you breathing techniques to help a patient suffering from asthma overcome breathing difficulties. They teach you effective ways of coughing, and they also help you to establish activities that will help improve your quality of life and decrease the chances of shortness of breath. So a great activity to participate in would, of course, be swimming. And then another great rehab facility that is located in Maryland, they focus on more holistic care, so herbal supplementation, acupuncture, yoga, and also mind-body medicine, which focuses on hypnosis and journaling.
Okay, thanks for that, Celeste. Thank you guys for tuning in to our nursing channel. That's all we have today. Be sure to tune in every Thursday to follow us.
Bye.